Ladies and gentlemen, welcome aboard to Toxin Zoom webinar. Hello，歡迎大家嚟到今日我哋第4期嘅 Toxin。各位帥哥美女們，大家晚上好，我是你們今晚的主持人 Grace. A very good evening to our beloved audience. I'm your host for tonight, Grace. 我們 Toxin 將會在每周五晚上9點給你帶來最新的研討會課題，記得留守我們的 Facebook 官方網站，獲取更多最新的消息。Our Toxin series will be held every Friday at 9 p.m. To keep you updated with the latest health topics, remember to stay tuned to our Facebook page to receive the latest news. 我们今天的研讨会主题是呼吸困难及驼背。Our topic for today is breathing difficulty and hunchback. 我们举办这个活动的口号是疫情先温情，医者有使命。Our physicians are on a mission to share their knowledge and expertise during this pandemic. 那么说到为什么我们要举办免费线上研讨会，这个疫情给我们的民众带来了很大的困扰，甚至也影响了一部分民众的收入。The reason we are organizing this free webinar is because this pandemic has caused a huge burden to most of us and caused some of us to lose our income. 所以我们决定借用网络平台给我们的观众带来一系列免费的线上公益活动。Therefore, we have decided to provide a free online educational live stream to all of you. 我们的线上公益活动包括了一系列的研讨会、幸运抽奖以及线上问诊的环节。我们希望可以通过这样的平台，给予更多有需要的人一个小小的帮助。Our free online sessions includes webinar, lucky draw, and free online consultation, as we hope that we are able to give back to the community during this period. 鉴于疫情短期内不会结束，越来越多的患者求助无门。As the pandemic continues, most of our patients are helpless and unable to seek treatment. 我们希望患者可以学会自救，了解治病的原因，预防病痛，通过运动拉伸和改变生活习惯，最大的程度缓解身上的疼痛与不适。We hope that our patients can learn how to help themselves, understand the cause of disease, prevent sickness, and relieve pain through home remedies, exercise, stretching, and a change of lifestyle. 每个星期我们会推出不同的课题，以求覆盖各个方面大家会面临的健康问题。We will discuss different topics every week in order to cover all aspects of the health problems that can occur to anyone during this pandemic. 接下来就到我们的幸运抽奖环节。我们会在每周的线上研讨会中抽取一位幸运儿，来赢取我们中心价值300令吉的免费体态分析与治疗。Tonight, a lucky winner will be selected. He or she will be entitled to win a prize worth up to 300 ringgit of free treatment with the full body and posture analysis. 那么要怎样才可以参与我们的抽奖呢？很简单，首先填写幸运抽奖的 Google Form， 然后去到我们的 Facebook page 和 Instagram， 搜寻信 Osteopathic， 点击 Like 和 Follow。接下来就是在 Facebook share 我们现在的这个直播，记得要 tag 3个朋友，然后设置为公开，这样您就有资格成为我们的幸运儿。To participate in this lucky draw, firstly is to fill up the lucky draw Google form, and then you will need to follow our Facebook and Instagram. Share this live on your Facebook and tag 3 friends. Remember to set your profile to public in order to participate in this lucky draw. 我们会在研讨会的尾声公布得奖的幸运儿，所以呢，你们记得要打起12分精神，留守到最后。我们的幸运抽奖活动将会在9点45分截止。We will announce the lucky draw winner at the end of this live session. Remember to stay tuned until the end. Lucky draw registration will stop at 9:45 p.m. 在我们进入今天的研讨会之前，如果大家有任何的疑问想要咨询我们的医师，可以在聊天室里发问。那么有些比较害羞的朋友不敢在聊天室里公开发问呢，也可以在研讨会结束后私信我们，我们会尽可能的回答全部人的问题。Before we begin the live session, if you have any questions, please feel free to ask our physician in our chat box. If you wish to contact us privately, you may WhatsApp us and we will attend to you as soon as possible.
Sorry， 再来 lag 了，你的
哪里？
这边开始 after 那个华语的啦。
哦，OK。
wait 了。
Before we begin the live session, if you have any questions, please feel free to ask our physician in our chat box. If you wish to contact us privately, you may WhatsApp us and we will attend to you as soon as possible. 接下来让我来介绍我们的诊所。Sin Osteopathic 一共有3间分行，分别是在 SS2、科蹦和 Sri Kembangan. Next, we will introduce our clinic branches, which are located at SS2, Kepong, and Sri Kembangan. 我们结合了现代脊椎调整技术、传统医疗法加物理治疗的方式，为患者提供一站式的治疗服务。Sin Osteopathic is a one-stop clinic specializing in the modern chiropractic techniques, traditional Chinese medicine, and physiotherapy. 我们的诊所传承了3代将近50年的医疗知识与经验，到访的病人就不必担心该如何选择怎样的医疗服务。我们专业的医疗团队可以根据患者的病情提供最合适的治疗。Invaluable knowledge and techniques have been passed down throughout 3 generations for almost 50 years. At Sin Osteopathic, our professional physicians will determine the best course of treatment, either modern chiropractic techniques or traditional Chinese medicine methods, depending on the patient's condition individually. 好消息，好消息 ，Good news！ 我们的诊所会在下个星期二正式营业。想要跟我们预约的朋友们，可以扫这个2维码，跟我们的后勤人员做预约。我会把联系方式放在这个聊天室里。Our clinic will reopen next Tuesday. For those who would like to make an appointment with us, you can contact us through this QR code. I'll also leave our contact information in the chat box below. 接下来我会播放我们诊所最新的 SOP 短视频，以确保每个人的健康与安全。We will now showcase a video regarding the latest SOP carried out at our center before each patient undergoes their treatment to ensure everyone's health and safety. 好，再次提醒刚刚进来的朋友，我们的幸运抽奖活动还在进行中，要参与的朋友赶紧填写聊天室里的 Lucky Draw Google Form， 里面会有详细的报名步骤，我们会在研讨会的尾声公布得奖的幸运儿，请记得留守到最后。我们的抽奖活动将会在9点45分截止。To our friends who just joined our live webinar, our Lucky Draw session is still going on. You can find our Lucky Draw Google Form and steps in the chat box below. We will announce the lucky draw winner at the end of the live session. Remember to stay tuned until the end. Lucky draw registration will stop at 9:45 p.m. 我们有请今天的讲师信伟伦医师和 Nicholas. Let's welcome our speaker tonight, Dr. Sky and Dr. Nicholas.
Hello，大家晚上好。我看到很多很熟悉的脸孔。So，今天我们的课题是呼吸困难跟驼背，但大家知道是呼吸困难开始先呢，还是驼背开始先呢？所以绝大部分的时候，就是我们驼背会影响到我们的呼吸困难。所以尤其是这段时间呢，大家呼吸困難的时候，大家就会想到什么？大家有可能会想到他自己有没有中了 COVID。So for next page. Okay, so 如果大家真的呼吸困难， 在家里最好 test 一 test 我们的 oximeter。如果 oximeter check 出来是 below 95，或者是borderline 的话，我就建议你们去做一个 swab test 以防万一了。So 通常我们如果有呼吸困难的话，我们就开始会缺氧。如果缺氧的话，我们怎样看到一个人是不是有缺氧的状态呢？我们可以透过我们的手指甲、我们的嘴唇，我们那个人有没有经常的头痛，或者呼吸很急促、很 short breathing， 然后他可能就没有精神的，好像不够力气的，这个就可能是我们一个缺氧的状态所形成的。So 以下我就让我们的另外一个治疗师 Nicholas 来分享一下关于我们的这个驼背跟我们那个呼吸困难的一个知识。Nicholas, pass to you.
All right. Thanks, Dr. Sky. So, hi everyone. This is Dr. Nicholas. Thanks for joining us today. Today we'll talk a little bit about breathing difficulties. Okay, so we'll break down into 3 different categories. We'll first have the elderlies, the middle age, and then at the end we will have our precious kids. Okay, so we will first begin with the elderly group. Now, in the elderly group, usually when it comes to breathing difficulties, aside from COVID, you will think of these few things. So first of all, if they are a smoker, okay, they've been smoking for many, many years. Now, a lot of times their lungs may not function as well anymore. Okay, their bronchus, their air sacs, they may not work as well anymore. Maybe it's inflamed. Maybe there's a lot of mucus. Okay, so it's not as healthy already. Next, you have high blood pressure. So people with high blood pressure, they also experience breathing difficulties. And of course, you have your obesity. So people who are overweight, if you don't exercise regularly or if you don't take good care of your diet, you can actually get all these fatty plaques, okay, built up in the bloodstream. So therefore, you don't actually get as much oxygen in your heart. So if your heart doesn't, cannot beat properly, then breathing difficulty may also occur.
OK， 对于这些年长的一些 elderlies 呢， so 我们要注意他是不是有经常抽烟的，他对不对肺部会比较不健康的，或者他缺少运动他的那个血管可能他没有这样好，可能有 fats 的阻塞所以影响心脏问题都会导致一些我们的呼吸困难的出现。
Okay, so in elderlies, actually, you would also think of accidents or trauma, because they're frail and sometimes they may fall, all right? So some accidents may occur. Another thing that we'll think about when it comes to breathing difficulties is whether if there's any fracture at the rib region. So a typical scenario here, as you can see at the X-ray, right? There is this part here where the ribs are not joining anymore. So here it indicates that there's a fracture at the rib.
其实对于老年人他们的骨头会比较没有我们成年人那么硬，他们的 density 可能没有那么粗壮。其实很简单，有时如果他们的骨不是的密度有减低的话，比如说他们拿东西他们缺少运动，长期手没有伸上来的话，他们拿东西如果撞到的话，很容易他们就有这个 fracture 的出现。So fracture 的出现很多，我在临床上我见过一些老人家，他讲我海看碰一碰，撞一撞，哎呀，我就觉得呼吸好像很辛苦。Then 我 check 的时候，我觉得他这个骨有可能有裂。Then 我就叫他拍 X-ray， 就好像以下那个 X-ray 这样子，他可能因为骨裂的问题 ，ribs 骨裂的问题，我们叫我们的肋骨骨裂的问题，导致他呼吸辛苦或者会疼痛的出现。
Okay, so what if you take an X-ray and it doesn't show any fracture, right? But after an accident. So sometimes there could also be, because in between your ribs, there are muscles as well. Maybe there could not be a fracture, but there could be a strain at the muscle itself. So this also can be a factor when it comes to any breathing difficulties in the elderlies.
如果我们在 X 光片那边查不到它是有那个骨折或者骨裂的状态，它可能是拉伤它的肌肉跟那些韧带，也会导致它那个 region 会比较辛苦，会比较痛，或者呼吸困难的情况出现。
Now, the next one we have is called Buffalo's Hump. And I don't know if you guys think this is familiar or not, but I think I have seen actually plenty of patients that have this kind of physique. So what Buffalo's Hump is that there's actually fat deposition. Okay, so there's fat at the back of the neck. You can usually see this in women, all right, within the ages of 30. Most of the time it's because there's this high level of cortisol hormone. So there's a lot of stress hormone. I mean, there's a lot of stress going on. And this can actually lead to this kind of posture and putting a lot of stress and strain on the neck and shoulder.
OK，for 这张图可以看到，其实很熟悉了。我们可能家里人啊，或者我们亲戚都可能有这样的状态啊，我们叫做富贵包了。我们可以摸一下颈项后面会不会肿肿一块的东西，然后很多年了它不小的。其实很多人讲，是不是我肥会导致这个有一个 bump 的出现？其实肥不一定会有那个 hump 的出现的哦。其实我们叫做富贵包啦。其实刚才 Nicholas 就讲了，可能是因为 stress 的关系。OK，stress 是 one of the reason， 或者你 posture 不好，或者吃太油腻的东西会导致的。
Now, next is called Doe Wagger's Hump. But if you have the buffalo's hump, and if at this age where you don't really take care, right, it can actually lead to Doe Wagger's Hump. Now, what this is over time, you can see that this is a very, very bad hunch, and the joints of the spine, right, they will start to degenerate, and then compression of the spine will also start to occur. When it's come to this stage, usually the overall quality of living, it will be reduced now because usually they'll be in a lot of pain, and doing things at this kind of posture is very difficult as well.
这个图画我们经常会在什么时候会见到呢？尤其是我们看到有些人是捡垃圾的一些人，或者他长期会弯腰去看地上做的一些工作的人。所以他们长期因为他要低头他们长期低头会导致他们的胸前的肌肉跟胸后的肌肉严重的不 balance， 所以他们长期这样 forward back bend， 他们很少会站起来。他们最站起来的时候，就可能是他们工作到很晚了，可能6点的时候或者早上一开始就开始拾东西拾到他们吃完了，可能到很晚的时候，他们才有办法站起来。那么他们站起来的时候，那个时间其实是很短暂的，所以他们可能太累了，他们就跑去睡觉。然后另外早上早上一起床，他们又要开始这个动作，所以久而久之，他们的脊椎，因为他们可能也负重的关系，他们的骨就开始有退化的现象出现。所以这种人呢，其实他站起来反而会痛，他弯腰他不会痛，因为他的骨已经是形成了畸形了，会有那个 degenerate， 已经是退化到一个程度，他这个是不可能再站直了的。所以我们讲这个 topic 是关于我们的驼背，我们就不要最后导致这样的状态。OK？
All right, next we have osteoporosis. Now, osteoporosis, once again, usually happens in women as well. As they hit the ages of 50, all right, once you hit the menopause, so once the period stops coming, then you need to actually start thinking of osteoporosis because that is where it's the highest risk. So your bones, they're actually not as strong as they are before, and it can no longer absorb calcium that well. So the bone matrix actually gets weaker. So therefore, fractures and stuff can actually happen much easier.
Osteoporosis actually 我们的中文就叫做骨骼疏松症。So 刚才 Nick 讲就是当女人开始要停经的时候 ，OK， 这样他们就进入一个退化期，我们就很容易导致我们的骨骼疏松症的出现。So 这种骨骼疏松症就是它的骨的密度开始没有那么坚固了，所以就如果跌倒的话，就很容易有骨折啊或者骨退化的出现。
So of course, if a fracture does happen, you can see that at the spine, right? Because it's not strong, it cannot fit anymore. So it will compress. And then therefore, the hunchback will start to occur. And after that, that will lead to breathing difficulties.
这个图就是我们骨密度开始不够强了。其实我们这个骨，因为你的姿势不对，长期姿势不对，有可能那边会骨折的问题出现。如果骨折它退化的话，它会慢慢变成可能你的 bone 不是三角形，或者可能有 fracture 的出现，就会影响到我们的呼吸困难。
Okay, so that is it for the elderlies, and now we will move on to the middle age. All right, so before that, right, there's one thing that you guys need to know about is that when it comes to breathing, it's not just the lungs expanding, right? Not just oxygen breathing in, but there are a lot of, we call this accessory muscles, like the neck muscles, you know, the diaphragm muscles. These muscles are actually helping you overall to breathe.
我们的呼吸啊，不单单是只是我们的lung去做，不是只是我们的胸腔去做活动。其实我们呼吸的时候，我们有牵扯到一些肌肉。我们可以尝试一下，多久没有认真的想下自己呼吸怎么样子？大家吸气的时候，吐气，我们身体是有微微的会动的，所以我们的胸腔、我们的后面的肌肉跟我们的颈项会带动我们整个人体。所以呼吸不单单只是肺部的活动，还有我们这些肌肉的活动也会是牵扯在里面。
Okay, so how many of you are actually sitting like this right now, watching this Zoom video? If you are, you need to start changing. So a lot of times it's posture when it comes to the middle age, because you'll be spending, especially at this point in time, you know, MCO, a lot of you are working from home and, you know, you feel it, you're in a comfortable state, and naturally you will sit in this kind of postures. So the first one, you can see that when you don't sit all the way in, when you leave a little bit of space, you tend to slouch, right? When you tend to slouch, then you tend to hunch up here. Or some of you, they don't really utilize the backrest, whereby you will start hunching as well. So some of you are so focused, right? When you're doing your work and stuff, you tend to go nearer to your computer and you just forget totally about the backrest. Now, of course, the best way to sit would be actually in a 90 to 95 degrees. So therefore, you have to sit all the way inwards to the chair and utilize the backrest.
OK， 所以这些就是我们平常经常容易犯的一些错误。有很多人坐椅子呢，他没有完全靠着那个椅背，就是只是把那个我们的背部就轻轻的靠着那个椅背，但是我们的腰部是镂空的。所以第二个就是开始很专注的做东西，哇，直接整个背都没有靠着那个椅背。OK， 第三个其实是比较正确的坐的姿势了。我们双脚要垫地，然后背后要靠着那个椅背。其实坐的十分直也不太好，我们身体要微微的向后倾斜一点，差不多95度是最好。所以在这里我再跟大家讲一些很多 parents 啊或者我们做工的一些迷思。为什么那些人经常会 hunchback？ is because 他们手放的姿势。手放的姿势不对，所以大家可以试下，如果我们是90 degrees 放在我们的桌子，越靠近我们身体，其实我们的背后那里就是我们那个thoracic 的地方，就是我们胸椎的地方，其实属于是直的，越90度我们就越直，所以我们 try to 把手放前一点点 ，right， 向前放前去，然后我们的背后就会开始会驼，大家可以做一下这个姿势 ，so。我们最好呢，那个手就越靠近身体越好，因为有很多人就是用 mouse 经常一边手向前呢，收他的 right side， 如果他是右手边的话，他右手边他就会比较紧。OK， 所以这个都是关于我们的一些工作跟我们的坐姿的关系，会影响我们驼背的一些小技巧小提示。
All right, so in middle age, well, sometimes if let's say it's not a injury, okay, it's not a trauma, an accident, the heavy duty workers, okay, if you have to carry heavy during your work, okay, so you actually spend a lot of hours carrying heavy stuff, or even lifting weights. At times, it may not present as pain immediately, okay, but it can actually manifest as an internal injury. And it's down the road whereby you will start feeling all these little pain, coming along. So it may not be immediate, but down the road.
So 这三个图呢，就是我们一些比较平常劳损比较多的人，或者负重比较多的人，他们可能他要carry weights，夾硬搬啊，冰柱很重哦，夾硬搬，你现在可以搬到，但是一搬了，呼吸好像很辛苦，可能你这边也会咔一声，也有可能啊，可能因为你平时没有拿那么重的东西，或者你经常提太重的东西，会变成一种我们叫内伤的现象。所以这个如果年纪慢慢大，随着我们肌肉没有那么强，慢慢流失的话，我们就会可能会年老的时候会比较容易气喘啊，导致我们肺部不太好的一个原因。
Okay, so here we have a breathing video. As you can see, as your lung expands, your ribs will also follow. All right, so in order for the entire movement to move, so not just your lungs, your ribs will also expand.
其实我们的 rib case 啊，我们不是完全是一直连着紧紧的，其实我们还有个 space， 它可以帮你expand 一点的。当我们吸气的时候，其实我们 lung 会扩大 ，right， 扩大一点，然后它会收缩，扩大收缩。所以这个就是我们的 ribs 的一个作用机制。这个 rib 其实拿来做什么呢？就是保护我们比较重要的 organ， 就是我们的心脏啊，我们肺部啊，因为这个东西比较容易刺穿啊，所以我们的骨啊，就是保护我们，如果我们被力气冲击的话，我们 ribs 可以保护我们这些比较脆弱的一些内脏。
Now, why is the rib so important when it comes to breathing? Aside from protecting all the important structures, right, like your heart and your lungs, when it comes to breathing, they are supposed to expand at the same time, all right? You have your ribs on the left and on the right side. So both of them, when you breathe, they're supposed to elevate at the same time. But that's not the case most of the time, right? I think I've came across a lot of patients at Sin Osteo when they are having breathing difficulties. You can just put your hands right underneath their scapular region, which is right here, and you can ask them to take a deep breath. So what happens is a lot of times one side of the rib will go first and then the other side will follow. So there's like this delay. So this actually plays a very huge part when you are diagnosing breathing difficulties.
我们的这个肩胛骨啊，我们中间的lung actually 我们吸气的时候是同个时间同步的作用，两边一起 explain， 一起扩大的。但是在我们临床上啊，我们 check 了很多 patient 呢，他可能会呼吸会辛苦的人啊，或者他的我们的中间的胸椎出现问题的人，可能他的 ribs 有侧弯啊，或者我们的那个胸椎有 misalignment 啊，所以我们吸气的时候啊，它不是同步的，他们可能一边的肺部长得比较大，所以另外一边它慢一点，可能一般或者慢一点点再长大，所以可能它是有 rotate 的现象，这个也会导致我们的那个呼吸困难的出现。所以怎么样去检查呢？其实很简单，只是我们放在我们的身体的肩胛骨的下面，然后看我们的身边的人，我们的parents 啊，我们的小孩子啊，会不会呼吸的时候一边大一边小？这个也是可以去测量，究竟我们的胸椎那边会不会有问题，导致他呼吸困难的出现。
Now, a lot of times why there may be a delay when it comes to breathing, right, in terms of the ribs, there's a possibility that there could be a misalignment at your thoracic spine. So when it comes to your thoracic spine, you can see that your ribs from the front, so just now we saw the ribs from the front, they actually come all the way to the back and attaches to your spine. If the spine goes out of alignment, it could be either the left, could be the right, depending on how your posture is, it can actually play a huge part in affecting the overall movement of the ribs. So that's why sometimes when you put both your hands there, you can see that, hey, there's like a delay, So one side is actually stuck and it cannot really move as well. And if you cannot expand as well, then breathing difficulty happens.
这个情况啊，如果那些有脊椎侧弯或者我们的胸椎有错位的人，其实他的胸腔张开的时候，可能会影响到一边比较卡压，所以另外一边可能有 pressure， 它不能这么容易的撑开它的肺部，所以这个是导致其中一个呼吸困难的原因，就很大原因是因为他们这边可能有 degeneration 有卡压，或者它有移位，会导致呼吸困难。
And not just the thoracic spine. So actually your neck can also play a part. Now remember just now the video when your lungs expand, your diaphragm muscle, which is right here, your diaphragm muscle actually contracts and it will push down so that your lungs has more space to expand. And this muscle here actually links all the way back up to your cervical spine, which is at your neck, typically at the C3 and 4 region. So if there's a misalignment at the neck area as well, it can also affect the muscle that is working at the diaphragm. And then therefore, it can also affect breathing difficulty.
其实不单单是胸椎了，其实我们颈椎，如果我们压迫到我们的 C3、C4 那些，或者压到我们的中枢神经，我们的脊髓也可能会导致我们的这个呼吸困难的情况出现。So 好像我们的横膈膜的肌腱或者肌肉也会影响我们的呼吸的困难。
Now, this is a real case study that we have a patient that's synosteo. He's a male and around 40s. So what happened was during this MCO, he fell on his back. Okay, so he fell backwards. And after that, he started experiencing chest pain and breathing difficulties. So he has consulted a medical specialist. All right, so they did all the different kind of tests, help him to do endoscopy, all right, put the scope all the way down, check all the organs, and actually found nothing. So after that, they just sent him home without further notice, didn't give any medications and didn't teach him any self-remedies and, just let him be. But he was actually still in pain. And so he had no choice. Then after that, he came to see us at Synosteo. This is a case where me and Dr. Sky both we actually saw him together. So what we found out after diagnosing was that aside from just misalignments at the rib and the thoracic spine, he also actually had an internal injury because when you fall backwards, remember the ribs actually connects all the way to the front, right? So falling backwards actually affected the part in front as well. So throughout our treatment, we gave adjustments and also just to help out with the injury that is in front. And after that, he actually felt much, much better.
这个 case 呢，就是我们其实很惊奇啦，就是这1-2个星期的事，就有一个男性，差不多40岁的时候，他就在这段时间有跌倒，最后时间有跌倒，所以他就觉得他呼吸困难。他来的时候，他的主诉就是他呼吸很困难，然后他胸腔这边很痛，所以他已经是做了你想象到的 test 他都做完了的 ，scope 心脏什么都 check 完了的，所以他 find out that 他们不懂什么问题，所以他讲他有跌倒，但是他 check X-ray anything 他没有骨折，什么都没有，所以这个就是。然后我们第一次的时候就帮他做了我们的 adjustment， 帮他放松他肌肉，帮他做 adjustment， so 他回来的时候他就 improve 了 50%， so 第二次的话，他 Nicholas 就发现到他这个状态不是那么简单， then 他就叫我过去看， then 我去 check， 他可能是因为跌倒的时候发生有内伤，so impact 我们讲 impact，它跌是跌后面，但是它 impact 可能会导致它的前面都受伤，所以我们就做了一些手法、一些 treatment，把它解决了它这边的肌肉的问题所以它就好了很多。这个是我们的近期的 case。所以如果你们的朋友或者家人会觉得呼吸很不顺，但是他胸腔这边一直痛所以你们找来找去就找不到原因的，可以帮我们去做一个 appointment， 我们很乐意的帮你去 check 一下你究竟是发生什么问题。
And of course, lastly would be posture. All right. So we're still in middle age right now. So you and I, 20, 30s, 40s even. So posture is very important. Now you should realize that there's actually curvatures in your spine. Okay? In a normal spine, a normal healthy spine, there needs to be a curvature. So at your neck and your lower back, they're actually the same. So there's this C-shaped curve we call lordosis, and at the thoracic spot, it's called kyphosis. Now, if it's too much, it's bad. If it's too little, it's also bad. Okay, so it's very obvious. You can see this is a very healthy spine over here, and over here is actually too much. Okay, too much curve. Now, a lot of people, they would ask, like, you know, whether if I come for treatment, can I actually grow taller? Okay, so the reason why it gives an impression of growing taller is not because you can actually grow in height, but if you actually have a good posture, right? If you fix up all the alignments, do your exercises, you can actually look taller in a sense. All right.
OK，so 讲到这边，大家说 posture 就是我们的姿势的问题。其实姿势的问题影响我们的驼背，经常都会发生的。So 现在大家看着 Zoom 的人去 check 下，有到底的谁的耳朵跟我们的肩膀是 align 的。OK， 我可以说绝大部分的人都不会有一个很好的 posture， 因为我们现在3C 产品太厉害了。So 我们尽量把头缩进去我们的身体，就是成一个水平线，耳朵跟肩膀要成一个水平线，这样就是最挺直的状态，这样我们的驼背就能改善。其实我们有2个，我们叫弧度我们的脊椎不是直的，千万不要以为我们脊椎是直的，我们脊椎需要2个弧度来支撑我们的身体跟我们日常活动的走动。所以第一个就是在我们的颈椎的地方，第二个就是在我们的腰椎。所以我们是呈于 S 型的，我们 thoracic 那边就是我们的胸椎那边其实是有稍微的往后吐一点点，但是吐的太多就是驼背，完全不吐也是不对，因为我们可能有那些强直性脊椎炎之类的，那些是全直的，所以他们很多是 degeneration 很快，就是他们退化到很快，还有他们呼吸很辛苦，因为他们的胸腔太直，没有那个 space 去 expand， 就是不能让他们去打开那么胸腔那么容易，他没有那个活动度这个也是我们一个考量的东西，所以要 check 咯。你究竟是你的 spine 是怎么样你颈椎有没有弧度，腰椎有没有坐直那些，我们就尽量保持一个比较好的姿势。所以调整了，那些人讲，喂，我高咗其实不是你高了，就是我们把你的肌肉跟我们的 structure 调整比较直就我们直的时候，其实我们会高一点的。如果我们 slouch， 我们人自然就会矮一点点。所以我们尽量要我们走路的时候向前挺直一点走路。
Okay, so let's do an experiment right now. Okay, now I hope you guys can follow me. So for step 1 here, I want you to give me your worst posture. Okay, I want you to look down. I want you to round your shoulders. Okay, and I want you to start hunching. Okay, so once you're in this position, I want you to take a deep breath and I want you to hold it. Okay, let's hold for 5 seconds. So 5, 4, 3, 2, 1. Okay, now I want you to try the second step. So return to a very good posture. Okay, so arms back, head, make sure you push your chin all the way in. Okay, so similarly, take a deep breath, hold for 5 seconds. 5, 4, 3, 2, 1. So hopefully you guys can feel the difference between the two. In step one, you will feel that when it comes to this posture, you feel very difficult holding the breath. Whereas in a perfect posture, you feel that it's actually much easier to breathe in and also, have breathe easier in general.
OK，刚才 Nicholas 教了一个方式，说他叫你 hold 着你的呼吸。OK，现在我教你另外一个方式去做 testing。So 其实很简单，我们的双手交叉放在我们的胸前。OK，交叉放在我们胸前，我们尝试大力的吸一口气。其实有点困难的。OK，So 我们就放平，我们坐直，挺直的吸一口气。其实是简单的非常的多，所以刚才我讲 Hunchback， 我们的驼背会影响我们的呼吸，就是这样的状态。所以如果你要呼吸正常一点你就要挺直你的胸腔，把我们胸腔打开的比较简单。OK。
Okay, so that is it for middle age. And before we jump into our precious kids, just want to let you guys know that we are also doing this giveaway. It's really worth it because it's a free treatment worth up to 300 ringgit. So hopefully a lucky winner of you out there will be able to get it. So please remember to register and we will move on with the slides. Okay, so now for our kids. Now, kids, there's this thing called congenital kyphosis, and they are born this way. So it's actually very obvious. When they're babies, you'll be able to find out already. And typically, the medical doctor would also perhaps order an X-ray, and this is what you will see. So this is a abnormal, the growth of the spine. It isn't built properly. So this is because they're born this way, and typically the only way to really fix this is through surgery. Yeah, so this is congenital kyphosis.
So 大家要留意，现在我们讲的是大家最关心的小孩子。So 小孩子的话对于这个驼背的问题我们现在真是发生到太过 popular 了，就是可能我们的孩子们都很多都是做咩行路行唔直嘅，彎彎嘅行路，这个就可能他们用3C 产品比较多。所以我们讲第一个 scenario 先，这个东西的话就是我们的天生的畸形 ，OK， 天生后凸的畸形。所以这种小孩子是他们天生的时候就是他们的 spine， 我们的 spine 每个四方形这样连接组成的，但是他们天生的时候，因为我们 DNA 的关系了，所以他天生就是三角形的，所以这个其实天生他们站起来他们都有一点点歪歪的。OK， 这种很容易就有那个脊椎侧弯的出现，不是很容易的，基本上是每个都会有脊椎侧弯，因为它是天生的 bone structure 的问题。OK， 所以这个我们如果看到我们的小孩子有这样的状态的话，其实这个是不可逆的啦，因为他 born inside， 他天生就是这样子，他出生就是这样子。所以除了做手术之外，其实是比较难去解决的一个问题。OK。
Now, the next one, I think this is very familiar to all of you out there. Now, actually, it's such a pity that the kids these days, they have to go through online learning, right? They have their classes through Zoom. And if it weren't for COVID, they will already be out in the open, in school, doing all the exercises, moving around. But because of the state that we're in, we're forced to stay at home. And of course, we cannot neglect that gaming, kids, when they do play games, it also plays a huge part when it comes to their posture. And especially at the age where puberty starts to come, that is where you need to pay more attention. So I'll show you a little bit in the next slide regarding puberty on what you need to look out for. But for now, here is that when it comes to online classes, you really do need to pay very, very close attention to their posture, because one thing will lead to another, and before you know it, you'll be hunching their back already.
So 这个都很熟悉了，大家这段 MCO 期间，如果你的孩子已经是成长了，会开始用电脑， 开始会用手机，开始会打游戏，你们都会，这个就是我们的所谓的最高几率发生我们的 hunchback，就是我们很多驼背就是这样子高峰期了。我们可以说是小孩子高峰期是他们多数是长期用电脑，他们的 posture 做到不好，他们姿势非常非常的差，尤其是现在这样的情况，有些孩子啊1年都没有去过学校了 ，OK， 他每一天就是开始送，所以对他们的发育很大很大的一个阻碍了。所以小孩子其实他应该是我们叫他去多动，我们人是需要动的，因为我们是动物，我们需要多动的。长期在一个不良的姿势Zoom 啊学习这样会影响到我们的发育的。所以我建议 parents 如果他们上完可能是1 to 2 hours， 就要让他们去活动活动一下，不能坐太久了OK。
Now, remember we talked about puberty, right? So within the ages of, actually it starts even way earlier when they're in primary school. And you actually need to start watching out for this really. But for girls especially, young girls, when their period starts to happen, that's usually about, could be either 11 or 12 onwards, then growth, very fast growth will start to happen. So we need to pay very close attention to their spine. As you can see here, this is what we call scoliosis, whereby from the front view, the spine should look straight, okay? Should look straight. But what's happening here is that you can see that there are two different curves. So one to the left and the other one to the right. And the structures beside, the one in black, that is actually your lungs. Now, what happens is that when there's scoliosis, you can see that one lung is actually smaller and the other lung is bigger. So, of course, when there is curvature, the ribs also will follow. And then because of the lungs, right, being this shape, one side is more compressed. And therefore, when they start breathing, most part they can actually feel that not so comfortable because one side can expand so much, whereas the other side is like compressed. So you cannot really open them up equally. And then therefore, actually this could also cause breathing difficulties for the kids as well.
大家看一看这个图呢，就是我们最担心的，我们脊椎侧弯。其实脊椎侧弯，最小我们5岁的时候就可以diagnose出来了的5岁到我们10多岁的时候，就是我们的一个脊椎侧弯，到它发育完成，就是我们18岁或者女生17岁、18岁的时候已经是不可逆了的，所以我们小小就要 check 我们的小孩子是否有脊椎侧弯这个问题出现。So 你看他的脊椎，刚才我讲脊椎不是直的，是讲它的侧边看不是直的，但是我们直看的时候，其实我们脊椎是直的，只是侧边看它有2个弧度，但是这个我们直看的时候，它已经是有一个侧弯的出现，所以它的 shoulder， 它的肩膀会有高低。所以你留意你小孩子站起来的时候，肩膀会不会有高低所以看到我们这个X-ray 的时候，我们可以看到，其实它因为侧弯的关系，我们的肺部一边会比较大，一边会比较小，因为它呼吸的时候，它不能两边同时有50-50的状态，所以可能它是60-40的状态，所以它可能会导致脊椎侧弯，导致我们呼吸辛苦的出现。所以还要讲，就是如果大家是在这段时间看小孩子写字的话，他的手有没有很贴近身体脊椎侧弯其实有时候是背书包拿重负重一边不 balance 之外，还是因为它的肌肉的张力不一样，就是我们左边跟右边的肌肉，可能右边的比较发达或者比较紧左边的它比较松，所以我们的骨当我们的发育的时候，我们比较紧的肌肉会把我们的脊椎拉去我们肌肉比较紧的地方，所以慢慢的产生脊椎侧弯的出现。所以写字的时候有很多小孩子的手 不是贴着这样写的，而是这样横着写的，横着这样来写的。这种，因为它横着写的时候，它的身体是一个旋转的状态，长期来讲，旋转过度的话，它回复来的时候，它就有记忆进入了那个我们叫做 memories， 就是我们一个记忆，肌肉的记忆。所以肌肉的记忆右边一定会比较紧的。所以我们要经常教孩子活动的原因就是我们要把两边的肌肉去活动，去 balance， 不要给它缺氧的状态，导致我们的肌肉紧绷。
Okay, so what kind of tests you can do at home? Actually, you can really do a very easy test, and you can actually see whether your child, if they have any scoliosis or not, if their spine is like sagging or not. Okay, so number one is very simple. So you can just place your fingers at the top of their spine and just go all the way down. Start following and see if suddenly towards the right or towards the left. Okay. So that's one of the very easy way. Another one is you can get them to put their hands together and then just get them to bend their back all the way down 90 degrees. You can actually see that if there's truly a scoliosis, there will be a hump. So one side of the back will tend to be higher than the other. And then that's when you know that they might or may not have scoliosis.
如果在家里的话，要尝试自己去判断小孩子有没有这个脊椎侧弯，其实也是蛮简单的。第一，我们可以用手放在我们的脊突的地方，就是好像我们摸我们颈项后面，摸到我们 spine， 就是我们脊椎，一颗一颗的向下摸，将从上面慢慢往下推到腰椎的地方。就一直放到我们的臀部上面，看我们那个 spine， 看我们的脊柱是不是呈于一条直线的，还是我们摸的时候，在胸那边好像偏一点左边，或者偏一点右边，下面就好像有一点偏左边或者偏右边，这个就可能是脊椎侧弯。如果你check 到它的肌肉好像它的 spine， 它的脊椎好像有偏移的话，还有另外一个方法可以测量的，就是我们的人向前，叫你小孩子向前，你看他的肌肉两边是不是 balanced 的。在我们店我们会用 scoliometer 去量啦，我们会量它上面它胸椎颈椎、胸椎、腰椎的地方，慢慢往下测量会不会有偏移。如果没有 tools 的话，没有那个 scoliometer 去测量的话，我们可以用手去按两边的肌肉，会不会一边特别的拱上来，会特别的凸。如果会特别的凸这个就可能有脊椎侧弯。有脊椎侧弯，可以快点去照个 X 光片。如果不是很严重的话，其实很快就可以改善了。
And also when it comes to posture, so hunchback and stuff, it's also not just breathing difficulties. A lot of times it can manifest as a digestive issue, or because you're so hunched, all right? The back is like all the way like this. When you lie down flat, then you actually will have a lot of discomfort. So a lot of people, they say, well, I lie down after a day at work and I feel very, very uncomfortable. Lying down should feel comfortable, right? Yeah, but because of that hunchback, when you lie down, you feel very uncomfortable. And for the kids, as scoliosis develops, they may actually have a body image issue. Then after that, depression, and all that will actually, it's actually not surprising in this day and age. So these are the things that you also have to watch out for.
脊椎侧弯不单单会影响到我们的呼吸困难，其实如果我们坐姿不好，我们脊椎侧弯会导致什么？我们 organ 的 compress 就是我们的内脏我们的一些肠或者我们的胸或者我们一些 organ 它压迫，导致我们一些会产生不良的那个情形出现，可能它是胃他每次吃饭他胃好像顶着很不舒服，这样看他是不是他的腰椎那边会出现侧弯，或者他睡觉的时候会不会讲，哎呀好像很不舒服他完全不能平躺。就是我们睡觉的时候平躺， 其实是属于最能放松的一个状态，我们的肌肉也最 balance 的一个状态。但是他讲他不能他一定要侧睡，他不能平躺的，他侧睡才能睡得着，他平躺好像有东西顶着这样，很不舒服。第三就是他们的 emotional，他们会不会因为脊椎侧弯或者他们的驼背导致他们穿衣服不漂亮他们就开始穿一些比较宽松的衣服，比较大件的衣服，他们要遮着他们很驼背的样子，这个会导致他们的发育，他们心理的因素不好会 depression 会忧郁症那些比较麻烦的东西出现。所以我们小就要很留意我们小孩子有没有类似的状态，所以 check 那个脊椎侧弯是很必要的。
Now, in regards to treatment at what we do at Sin Osteo, our main goal is actually to get you to have an improved breathing quality. Okay, so main goal is to actually have more, all right, adequate oxygen supply. By improving your posture, naturally you get a better oxygen supply, so better breathing. A lot of things that we include adjustments, acupuncture. Actually, also in this case, you guys will also need to be very hardworking, right? Because you need to do your exercises. While you do exercises and the treatment that we provide at our end, it could actually produce a very, very good result.
在我们的诊所其实也算蛮多的，他来的时候讲唞氣好唔舒服，頂住咁樣，就是呼吸很辛苦他很難 focus 他要做的東西他一做工他吸氣就好像頂着這樣，可能會導致頭痛暈眩頸痛，因為我們的胸腔如果我們吸氣不夠的話，我們氧氣其實少了去 pump 進去我們的頭腦的地方，我們頭顱的氧氣會缺氧，缺氧的話我們 focus 東西，我們看東西就可能會模糊然後模糊會導致人不精神，然後我們頸椎我們頸項的肌肉也會拉着，這個其實都是有一個連帶關係的。像我們診所的話，我們會做一些我們叫 maintenance 或者幫你解決這個問題，我們有很多方法啦。所以絕大部分如果是你是我們的駝背或者我們胸椎產生錯位導致的呼吸困難，其實都很快，可能 maybe 1-2個 treatment 我們就可以幫你解決這個問題了的。
Now, for exercises, okay, so actually in today's presentation, we're going to show you some exercises that you can do as well. But mainly what you need to focus on is, like we mentioned before, your ear, right, and your shoulder. Try to get them in the same alignment. Because a lot of time when you start to hunch, the head will fall forward. So this is not a good posture, right? Naturally, we want the ear and the shoulder all the way to your pelvis, knee, and ankle to be in a straight line from the side view.
这个图就是告诉你们怎么样才是一个正确的姿势。我们站有站姿，坐有坐姿。所以我们站的时候，我们要 make sure that 我们的耳朵跟我们肩膀是呈于一条水平线的。所以我们的耳朵、肩膀跟我们的盘骨、膝盖跟我们的脚踝一条水平线下去是最好的状态。所以绝大部分我们现在看到的是我们讲乌龟颈就是颈项很 tilt forward， 这个就是我们的工作的关系了，这个是无可避免，但是我会教你一些运动，可以把你的颈项放回去，我们身体坐在我们的身体变成一个比较好的 posture。
So we'll start from the neck region, then we'll slowly go all the way down, all right? So at the neck region, we have what is called a chin tuck. So if you realize that if you work on the computer a lot, you know, your neck will start to go forward. Now this is the time where you want to push your chin back in. So by doing this, you can actually promote the normal neck curvature. A lot of times, the neck will actually look like this. So it's too straight, all right? What you want is the curve. So by doing this exercise, you can actually get it to go back to what it's, you know, its normal curvature. So we recommend doing this for, 10 times, all right, and 3 sets. So you really want to promote that normal neck curvature.
这个运动呢，就是好像我们讲我们的脊椎，我们颈椎过直的状态的人，我们就很 promote 他做这个运动，我们叫 chin tuck，也是我临床上最常叫人做的运动。如果你颈椎很不舒服，基本上就是你的颈太过向前 forward，所以我们要把我们的颈椎向后推。越靠近我们的身体越好。像我们只按着，像我们 hold 着了，我们可以 hold 10秒钟，1、2、3、4、5、6、7、8、9、10，然后我们会觉得颈项后面会酸酸的感觉，所以我们可以做3到7次啦，这样慢慢的恢复我们的那个颈椎的一个正确的状态。
Okay, so next we have shoulder rolls. Okay, so after doing the neck region, we'll slowly move down to the shoulder. Now for the shoulder, this is a very simple. So we start off with something easy first. Okay, now naturally, of course, if the head drops forward, your shoulder will also roll forward. Okay, so this one will actually want you to roll it backwards. So make sure you roll it towards the back. So you want to reverse the bad posture. Okay, so typically, similarly, you can do this 10 times. All right, 10 times, and do it for 3 sets as well.
So 我们的运动啊，都经常都找一些大家比较容易做到的运动。其实这些是很简单的运动，尤其很适合小孩子跟我们的大人。So 第一个我们教的是 chin tuck，就是把你头向后推嘛。第二个就是小孩子开始上课上完了过后，他们觉得肩膀可能它比较紧，或者我们用 computer 太多的话，肩膀会觉得比较酸、比较紧的时候，我们就向后做一个伸展，我们肩膀可以往后推，因为我们经常是向前打字啊，我们用 mouse 全部的手是往前做的一个动作比较多，所以我们太长往前的话，这样我们就要向后靠的回去，所以这个可以做10次，你做的时候可能会觉得肩膀后面酸酸的感觉，或者我们的 scapula， 我们肩胛骨的地方会开始会很紧的感觉，就是因为你长期用电脑的姿势不对，导致你的后面的肌肉增生了。所以有很多人呢，他讲，哎呀，我们坐直很辛苦。而坐直很辛苦的原因，是因为可能你的后面的肌肉已经是 build up develop 了太大块太硬了，很多人都解决不到那个问题。他可能讲他的肩胛骨旁边该一个都会痛啊，这个可能是 due to long time 他的姿势不对，导致他的肌肉产生硬化，导致硬化的问题。所以这个运动其实是很好去解决我们的这个scapula 痛，我们肩胛骨痛跟我们的 shoulder 兩邊好似雞蛋咁硬，一撳落去好似唔係雞蛋，好似 stone stone 好似石鼓咁硬。这些运动你这样做的时候，其实我们的blood circulation 会好一点啊，这样我们 oxygen 会 pump 进去我们的 disc 啊，我们的那个 round shoulder 也不会那么 forward to front， 也不会这么向前。其实这个不单单可以 for 我们的那个呼吸辛苦啊，或者我们的shoulder 比较硬啊，其实对于那些 frozen shoulders， 就是你觉得你的肩膀有卡卡的可能有50件的，我们上一个 topic 讲的50件的其实我们也可以做这个动作去舒缓两边的 shoulder。
Okay, so next we have the Latissimus Stretch. Now, if you're able to do the first 2 exercises, then you can definitely proceed with this. So, of course, first is the neck, the shoulder, and now we're going to go all the way to the back already. Okay, so you want to put both your hands together. Okay, you want to push them all the way down, and then you want to bring it all the way up. Okay, so this can actually help lengthen the back. A lot of times in the poor posture, all of the muscles are so tight behind. So this is one of the easy exercises that you can just stand up and then just do it. So it won't be too difficult. So you can try this one.
OK， 这个动作你可以坐着做也可以，站着做也可以。如果你可以的话，站着做会比坐着做好。我们先讲坐着做。So 这个 stretching 其实是拿来做什么呢？这个就是针对我们的背后的肌肉。 OK， 背后的肌肉跟我们前边这边的肌肉，我们背后的肌肉我们叫做背阔肌啊，背阔肌，就我们背阔肌很大块的 muscle 来的背阔肌，我们用了电脑太久，这个是很好的运动，它不单单可以把你肌肉拉伸，还可以把你的 spine 去做一个伸展的活动。啊，这个是非常好的。好，如果那些要有 degeneration 呢，他的脊椎比较薄了，或者年龄比较大的，我就建议多做这个运动，因为这个不单单是 for 后面的肌肉，前面的肌肉也会有拉到，所以很多老年人一跌倒，他就会 strain 啊，他会拉伤他的肌腱了，因为他的手啊很久都没有向上摸东西，因为我们啊都很少去向上做这个运动，可能我们换灯的时候才会用到，所以我们经常要像做了电脑太久去做一个拉伸，也是向上推，越上推越好。所以我们觉得我们的后面的肌肉会这样被拉伸的感觉，所以我们这样子后1、2、3、4、5、6、7、8、9、10，也是后10秒可以做3到7次了啊，3到7次，看你的肌肉，你每做一次，你后面的肌肉就会越松。So 你有 Hunchback 小孩子也是可以做这个运动。So 慢慢的突进，第一个动作先做，第二个动作先放松肌肉，我们的 shoulder 肌肉，第三个我们后背肌的肌肉啊。
All right, so definitely agree with Dr. Sky there. So next we have pec stretch. Okay, so this level is similar as the one before. So if you can do that, then you can do this as well. Now, one thing you need to know, right? When you tend to hunch forward, your pectorals, your pec muscle here, it will close up. Once it close up for a certain period of time and it will get very tight, then this one here actually will cause a lot of pain, a lot of problem also. Now, doing this pec stretch can actually reverse it. So by putting both your hands behind and then you start pushing, you can actually lengthen this muscle over here. And then at the same time, of course, if your back is hunched, by doing this, you can also reverse it. So it's very similar to the one before, but this is very much recommended because you're actually moving both ways.
刚才那个动作前后也可以拉，但是是 more on 后面的more on 后面的肌肉，这个是 more on 前面的肌肉，就我们的胸肌我们可以拉我们的胸肌。So 如果你呼吸困难，这个是最好去解决你呼吸困难的。So 你这样拉着后面的时候，然后你吸气 hold 着，然后放开，吸气 hold 着放开，然后你做了几次过后，你放手，你吸气就很顺了 OK， 也是一样，你可以这样拉着，可能你做10秒，然后你做3到7 set 了。
All right, our last and final exercise. Okay, so actually all these are very simple. The ones you saw before, you can either sit or stand while doing them. But this one here is focused a little bit more on your breathing. Okay, so this is cat camel. Now you can be on all fours, and as you take a deep breath in, you want to hunch your back all the way up. Okay, so when you take a deep breath, you hunch all the way up, and as you come down, you want to exhale and drop your stomach. So this one here is more of a yoga pose. So you want to really take time with this one. All right. So if you have time, you can try to do this, try to smoothen out your breathing, control your breathing. This is a very good exercise.
OK， 这个就是比较进阶的exercise。如果你觉得上面那些运动都太简单，这个如果对于那些有做 yoga 的人，其实都很熟悉。这个我们叫做 cat and camel， 就是我们将趴着的时候，我们尽可能把我们的胸肌的地方，还有我们的后面的脊椎往后吐的一个状态。那个时候我们就要注意我们的呼吸，我们那时候就把那个气全部吐出来，然后我们向前的时候就开始吸气。这个动作其实我们 recommend 越慢越好，我们是 focus on 做对的东西，而不是快快做完那些 step 我们就觉得好。其实我们做越慢越好，一来我们做 stretching， 二来我们调整我们的呼吸，把我们全身肌肉都做一个平衡。 我们一做了那个动作之后，我们要 hold 着10秒，把我们的肌肉拉伸，然后我们一样可以做3 set 这样子，3到7 set。It depends 你的时间了，but 3 set 已经是如果你很认真做的话，其实你都会觉得有一点效果。如果你觉得有点效果，能做多一点，我们会建议的，但是最好就不要超过，最好不要超过7到10 set 了，7 set 已经是松完了的。
Yeah, so I totally agree on that lah. So mainly we want to focus is the breathing and of course doing it correctly lah, right? Doing it too fast. Sometimes you may also injure yourself, right? If your body is not ready to take it. So yeah, actually we've actually come to the end of the presentation. Dr. Sky, you have anything else to add?
说都是小孩子啦，其实我们这段时间老年人就要少出去啊。现在的 COVID 也比较严重了，每一天都2万多，都少出去。如果有问题的话啊，你可能要带他去做一个我们 oximeter 去每一天去 check 去 monitor 它会比较好。如果真的会发现到他的呼吸比较严重，或者他有点发烧啊或者咳嗽的问题，最好就是我们去做一些 test 啦。现在比较方便，以前做 test 我们要去医院啊，或者去一些相关的部门，他帮你做那些 swab test。如果你觉得他的状况不是很特别的明显，他们症状不是特别的明显，你也可以在家里做一些我们的口水的 test 啊。如果你买不到，你可以联系我们的后勤人员。我们的诊所每一个病人来我们的诊所的之前，我们都一定要做了这个 test， 去保障你们的家人，也保障我们的医生、我们的员工。我们要控制这个病情的蔓延呐。如果大家有需要的话，可以联系我们的后勤人员呢。
好，谢谢我们今天的2位讲师 Dr. Sky 和 Dr. Nicholas。那么接下来呢，我们就进入到我们的幸运抽奖环节。那我们有请我们的后勤人员来展示我们今天的这个轮盘。So we'll move on to lucky draw session. So let's have our crew to spin the wheel for tonight. Alright, congratulations to Wong Ai Kin. 好，我们恭喜 Wong Ai Kin 可以获得我们价值300令吉的免费体态分析以及治疗。
恭喜你啊！恭喜你啊！
恭喜！
我知道
Congratulations.
我这个朋友他是很捧场的一个朋友，一个 brother，他也是我的病人，他也是有一些 back posture 的 problem 的，跟他的一些 compression，but 他很用心的听啦，我们每一个 sharing 啊，他都会 join 我们，你是值得拥有这个 prize 的啦，我觉得。希望你继续再支持我们的Toxin。
这肯定的，没问题的。
好，恭喜我们今天的得奖者。那么今天没有获奖的朋友们呢，你们也不要气馁，再接再厉。我们下个星期五也有这个抽奖环节。To the rest of the viewers, not to be disappointed, because we will have another lucky draw session on our next live stream on every Friday. 那我们今天的 live 已经来到了尾声，感谢各位的参与。Talk 下个星期五同样时间，我们会以下个课题的是颈椎病。那记得下周五同一个时间晚上9点，我们不见不散。We have come to the end of our webinar. Thank you so much for joining us today on Toxin. We shall see each other again next Friday at 9 p.m. Our topic is neck pain. So see you guys next Friday.
这个颈椎病就最多人想听的，大家一定要留意我们下周五的一个颈椎病的分享。下个星期五见，拜拜，晚安。
大家晚安。
Thank you.